Hello, today we're going to talk about liver cirrhosis. So let's go ahead and get started. So the liver. Alright, so let's talk about first about the functions. So we know the liver is very important, right? So reasons why. So the liver works very hard, gets rid of the toxin. Also, it helps with digestion. Also, it helps in formation of vitamin K, right? So that's like for clotting, clotting. And also, it has many more of this, but I do believe it's the main ones. And then it also toxins, adjacents, and clotting. It also helps with toxin, I guess, on blood forming. That's also blood. So, the liver is really important, like I said, because with it, all of this, it helps with all of this, right? So, what happened in liver cirrhosis? Let's check that out. So, let's draw a liver once again. So, what happened in liver cirrhosis? Say you eat tons of fatty food. That is not bad. That is not good for your liver, sorry. Let's say that you take some aspirin, okay? And many other medication. So your liver has to get to work to do that, okay? So let's say a couple cells get damaged, right? Your liver go ahead and regenerates. But what happened with liver cirrhosis is that because too much of this, also hepatitis, let me add hepatitis here. Too much of this is going on alcohol, fatty food, aspirin, hepatitis. It's going on in the liver. Your cells don't have time to regenerate, okay? And then because they're not able to regenerate, what's going to occur is liver cirrhosis, also known, categorized for liver scary. So wherever was cell is going to explode. So that's basically the pathophysiology. So it's irreversible damage to the liver. So that's when it starts scaring. It is the end stage of liver disease. Now, what you will say yourself, okay, so now liver cirrhosis had occurred, right? So let's talk about manifestation. Okay, so let's say you are in the ER desk, right? You're, cool nurse there, just waiting. Let's just make it rest. Just waiting, right? So what type of patient? What type of patient will have liver cirrhosis? Well, a couple causes are excessive alcohol, too much alcohol. Also hepatitis. And as well, the other one is, I believe, is NAFLD, which is non-fatty, so it's basically for fat. So liver cirrhosis, a fatty liver. All right. So these are the causes. Now, risk factors are kind of be the same. So basically, smoking is a risk factor. Being obese, because you could get half of that. Age as well. because more and more people drink more alcohol at an early age than before. And hepatitis is also a risk factor to develop a liver cirrhosis. Now, a patient with liver cirrhosis will have a couple of manifestations that you will be able to, see without any problems. So here we go. Okay. So let's go. So patient with liver cirrhosis is gonna have yellow skin. Okay. Also known as jaundice. A patient with liver cirrhosis is also gonna have, his palms are gonna be red. So it's like gonna be like red palm erythema, red palms, red spots on your palms. And they also gonna have spider angioma. So a spider angioma could up and from the shoulder to up, and it's like a little palm, and then like so it's like varices. So also known as spider angioma. And then you have, we already talked about the red palms as well. You also gonna have, remember, all of this is occurring because the liver is not functioning properly. Therefore, blood is not going where it's supposed to be. So if you go more down besides the skin, you're losing, you become anemic because you're not getting the right the vitamin K that we need. It's created by the liver, and if your liver is not working, it's not making it. So therefore, you lose discoloration. Now, you also do albumin on the liver, right? So because of lack of albumin, what's going to happen is ascites, peripheral edema. And the peripheral edema is because inside the blood vessel, right? The albumin is the one that brings the fluid back inside, so the colloid pressure. And because albumin is not being produced, it's going to cause fluid retention. And also, because of liver, the body is going to start creating antidiuretic hormone, preventing for fluid exit. So more fluid is going to be inside. Now, vitamin K. Vitamin K is part of the clotting factor. So patients going to be able to bleed more easily. So you're going to see gun bleeds. Okay. And troponin time is going to be low. TP is going to be down. Troponin time. So the cooling factor for the lab is going to be low. Okay. So what happened is as well. Again. The liver's gonna get bigger, so enlarge bigger, and because it's gonna get bigger, he's gonna be like, okay, I have to develop my own system. Okay, so what they're gonna do is it's gonna develop their own system to get that blood. All right, so it's gonna try to get that blood from the intestine, and that's why you have this veins right here. I forgot the name. Okay, and this veins right here to get the blood back. But the problem with this vein, varicose vein, is that they're extremely delicate and the patient can bleed. It's also known as a complication. Okay, because it's very fragile. So you want to prevent anything that it's gonna exacerbate the bleeding, which are like aspirin and other medications. All right, so let me just finish for clinical manifestation before I go down. You're also gonna have a sweet breath once the liver is completely dead. And also, because your liver is the one that take away all the toxins, you can develop cephalopathy because your liver has all this ammonia. So basically, it's gonna be toxic for you. All right, so for all of this, you can see, we should just lead to complications. since we are playing all that. So complications. All right, so for complications, we have portal hypertension, which is what I explained. What I explained earlier about the the liver like changing, basically creating a new highway for the blood to go. So it creates these little varices, tree-like in the stomach. Also, it's gonna have it could be either esophageal or gastro. The thing that you need to know is that esophageal varices are more likely to breed than gastric varices. You're also gonna have peripheral edema once again. And you're also gonna have ascites, which I already talked about. It's the beer belly, right? And then you're also gonna have encephalopathy. For encephalopathy, also known as coma, we talked about it already, is the ammonia doesn't have a place to go, so it goes inside the brain. Okay, a patient's gonna be like lethargic, confused, and they're gonna have the shaking syndrome. So their hand is gonna shake when it's in a flex motion, up and down rapidly. Okay, so what's gonna happen after these are the complications? So let's move on. Okay. Oh, the name, before I forget, the name of this virus is on the stomach is Capu medusa, which is the ring-like in by the stomach. Okay, so what's gonna happen afterwards? Also, after this, you should access carefully your patient for lungs. Okay, because we don't know whether, since the liver's not working, everything is a mess inside there. Okay, so let's see how we treat some of these complications here. Ascites. Okay. So for ascites, there's a couple things that we should do. Okay, we need to assess the vein. Okay, assess the vein. The reason why, this is, well, I guess it's ascites/venous. We want to make sure prevent bleeding. We don't want the patient to bleed. Now the patient has a lot of fluids inside, so that's gonna be uncomfortable for this patient. Okay, so it's gonna be distended, and a patient with ascites is gonna have signs of dehydration. So it's gonna have dry mouth, muscle weakness, sucking eyeball, and decrease in urine eyeball. Also, as well, this patient might develop a hypokalemia. So, remember, patient needs to poo. If he's not pooping, check for sign of hypokalemia. Okay. And then for encephalopathy, it's gonna be so we need to make sure that we check the ammonia levels. Okay, make patient poo, because we need to get rid of all that ammonia. Okay, Remember what Miss Siri says, pool is toxic. Let me make a night pool here. Give me a second. So you guys have more of a visual, okay? Here's my pool. And remember, you need to get rid of it. It's toxic. And that way we prevent encephalopathy. Okay, once again, the flapping hand for encephalopathy, which is a common symptom, it's also known as the Cirrhosis. I remember all these fancy words, but there we go. Now, what would you expect for a patient diagnosis study? So a patient that has a liver disease will have a ACT, of course, ALT high for circulation. They're also gonna have, you know, the alkaline, aspirate, and also the GGT high. However, if the patient has completely liver failure, these are not gonna be high because they're dead. So there's not gonna be shown. So the only way to really differentiate we had to do is a liver ultrasound. A liver ultrasound, because like this is not necessarily gonna be high. Okay. Oh, also the protonin time, the TPP time. I'm sorry, the clotting factor basically is gonna be prolonged. Once again, because we don't have that K, that KK, that is gonna help us clone. Okay, so what we're gonna do, we wanna make sure that we basically take care of our patient. If they have an ascites, right, we wanna provide whatever they need in order to feel comfortable, because remember, this is a very uncomfortable, you know, having your stomach like that, it must feel really uncomfortable. So what we're gonna do is, for a patient that has ascites, we're gonna not give him more than 250 to 500 mg of sodium. The reason why is because water and sodium are in love. So wherever sodium goes, water follows. And the patient already have enough fluids. So if you give him more fluids, it's gonna be very, very dangerous. It could be fluid overload, it could go to their lungs, it could like explode, like it's too dangerous. So one of the process to remove it, to provide comfort to this patient, is gonna be the paracentesis. Peter did mention that we want to make sure for paracentesis that this patient blood pressure is normal, because remember, the blood pressure goes inside a vessel, right? So what will happen is that if they remove the fluid, more fluid from the blood vessels, it's gonna go away, so the blood pressure is gonna go down. Okay, and also if they do a needle, oh, I'm feeling on track. So we're gonna tell the patient, hey, no alcohol, no aspirin, especially for cirrhosis, which is where we are now. In order to decrease the risk of bleeding for those patients, we're gonna provide beta blockers, beta blockers, which are like anything like Metropol, everything that finishes with O. Those are the medication that is usually prescribed with a patient that has varices. And okay, so also as well, a patient with varicose bleeding, Remember, IV therapy, you have to access for loan sounds. Make sure that the patient is clarified. You might, these are all nursing interventions. Let me put it here. You wanted as well manage management of patient pain. As well, you want to provide potassium sparing diuretics. Okay. Potassium sparing diuretic. And some of the medication might include vasopressin. As well, we also, depending, like we might need like a pack of red blood cells if they lose a lot of blood because of the viruses. We also might need, you know, something to make him food because we want to get rid of the ammonia, right? We're gonna need supplements, of course, of everything that the patient is not doing. So vitamin K. We also want to give him vitamin B12 because he's gonna feel lethargic. So, I see here. So we're gonna give them as well PPI, okay, to prevent more acid because everything is going crazy inside the liver. All right, and then. All right, so I also have like common things like when patient should be in a semi-follower position. That's to help him with the pain. And also we're gonna assess the patient regularly. Also for nutrition, okay? We're gonna go with high carb diet. For nutrition, we're gonna go with a hard carb diet. So that's like bread, okay? I'm pretty sure you know what high carb diet is. And also we're gonna go with a high protein. The reason why for high protein, it's not necessarily bad for people that has liver cirrhosis. However, it's very bad for people that have end-stage renal disease because proteins are not good for the lung. I'm sorry, not the lungs, the kidneys. All right, so we're gonna do a turning schedule if they need it. We're gonna teach the patient how to avoid alcohol. The importance of rest, okay? We wanna give this liver some rest. It's skin, take care of your skin, you know, because the skin is gonna be like dry, itchy skin. It's part of the symptoms as well. You're gonna have itchy skin. Advise the patient to avoid alcohol. If they're not able to avoid alcohol, go to Alcoholic Anonymous, the AA meeting. You know, promote liver function by adhering an adequate diet. I'm sorry. So we should also, okay, and as well before the parasynthitis where they remove the water, you want to have the patient buoyed because you want to prevent for the patient, for the bladder to be, you know, pinched. So you want to have the patient buoyed before that. You're gonna keep checking for urine because the urine is gonna be like, let me try a nice toilet here. You know, because you're losing biliverdin. So the liver is also in charge of, I don't know how to pronounce it, so I'm just gonna spell it. Bilirubin. Okay. This is a nice toilet. So your shit is gonna be like, it's not gonna be brown like the regular color that it should be. You're gonna have like gel, like stonorrhea, fatty looking gel, because your liver is not able to break down the fat, you know. So that's why you want to avoid a fat diet. All right, so that's all I have so far, and just if you have any questions, please let me know. Thank you. That's it for me today.